So I'm a physician. First, do no harm is something I live by. I don't believe obesity in and of itself is a disease, right? And I think one of the things you nicely highlighted in your talk was anything that says like it's all this or it's all that is not something we can clinically apply to large swaths of the population, right? So particularly when thinking about people with binge eating disorder, for example, whether they're average weight, larger bodies, how do you know? It's not like I can go over to the clinic and put somebody in a PET scanner and say, okay, this person has the biomarker of addiction with this food substance, but not this one and this one and this one. So when you're making that decision point, how do you know for whom this would be a useful intervention and for whom this might be a very harmful intervention?
It's a great question. I think this is where we are right now, is trying to figure out how do we apply this to help patients who might be struggling and how the food addiction research and model might actually be benefit to them. My experience has been that people who have found that all other methodologies have failed them often find that the food addiction approach resonates with them. And it's largely because they were asked to do a variety of things in the past that just didn't fit with what their symptomology was. And now the food addiction component seems to actually address some of the issues that they have. I also think that we don't really have enough diagnostic tools. We have the YFAST, which isn't necessarily a diagnostic tool, it's really more of a research screening tool, but that can be one way that can help patients to see what the relationship with food is like and whether or not it's in that addictive realm. I think to me, it comes down to, figuring out if the description of the symptoms sounds like an addiction. So when the person's talking about their struggles with food, does it sound like one of your other patients who's talking about their struggles with alcohol? And if the conversation seems to align, then I think that could be an indication that the food addiction model might be helpful.
Well, and also, keeping in mind what an eating disorder looks like, right? So if somebody with, a BMI of 15 is giving me this story, I'm going to have a different hat on than if it's somebody who has, a BMI of 25,
right,
for example.
Exactly.
Awesome.